How should I approach mental health struggles while staying true to my faith? So when it comes to mental health issues and struggles, I would say that there are probably 4 major issues that need to be dealt with. That is going to be anxiety, depression, substance abuse, and psychosis. The problem is, it's a layered problem and it's a layered issue, and may Allah subhanahu wa ta'ala aid those who are suffering from this. But the number one problem that I'm seeing with a lot of youth, at least, is there's a lot of self-diagnosis. And self-diagnosis is when somebody feels something and they say, I have this. An example is if I have a cough, right, and I'm like, oh, I have the flu. It is not my job as an individual to diagnose what sickness and what illness that I have, right? That's not my job. I can feel certain things. I can feel sad. I can feel upset. I can feel hurt, right? I can feel these things, but these feelings don't equal a clinical diagnosis. So I think that this is a huge part of the problem, that there's a lot of self-diagnosis that's happening with the youth, and when an individual self-diagnoses, what they do is they also fall into what is called self-treatment. If I have a cold or if I have a cough, right, the moment that I start trying to treat myself, I can actually make the situation worse. So you have some youth who will say, oh, I have anxiety, and for my mental health, I need to stay away from people for 3 days. Who diagnosed you, and who said that this was the treatment that you needed? Because all of this is based off of feelings. Many times it's based off of shahwa. Many times. Not every time, but many times. And the reason I say this is because if I truly wanted a solution to my anxiety, or I truly wanted a solution to my depression, I would go to a professional to help me diagnose that problem, and then the professional would tell me how to deal with those problems and deal with those issues. The other layer that I have a problem with in the whole mental health discussion are the mental health counselors. There are a few things that I notice in the mental health industry. Number one, I find the mental health industry in general, illa man rahimahullah, to be very predatory. I find that there are many counselors, many therapists, many psychiatrists that take advantage of people who feel that they are suffering from these problems, these issues. It doesn't mean that there aren't some good ones, and it doesn't mean there aren't people who aren't doing good work, but in general in this industry, since the pharmaceutical psychiatric industry was founded, mental health cases and issues and problems have only gotten worse, exponentially. Things have not gotten better. And it's very clear the path and the process and the pathway that these things are taking. And the reason I say this is if you actually look at data, there has not been a psychiatric issue that has been quote unquote solved. They've only gotten worse. And many of these counselors, whether they be individual counselors or individual therapists or marriage counselors or marriage therapists, they will charge $100 to $150 an hour. And the reason I feel that this is scary and dangerous is because such individual and such people, they're taking advantage of me when I'm at a very vulnerable point. Like I'm hurting. I'm hurting because I have this problem, I have this issue, and now you are charging me this exorbitant amount of money. And many times, without shyness, they'll be like, okay, the minimum I do is 8 sessions. So you have to buy an 8-session package, and I'm paying $100 to $150 per session to come in. I'm $1,000 invested into this person, and this person has yet to provide me a solution for what my problem is. There are different types of therapists. There are different types of therapies that are available out there. I think that there are some types of therapies that are very helpful, right? I think that's important. The problem I have is there are 2 types. There's the problem-focused therapies, and there are solution-focused therapies. Solution-focused therapies are very few and very rarely practiced amongst practitioners. And if you have a counselor or a therapist, ask them. Be like, hey, what kind of therapy do you practice? Vast majority of them will practice CBT, which is cognitive behavior therapy, which is also problem-focused. My suggestion for anyone who's facing or feels like they have these problems or issue, look for a practitioner that practices SFBT, which is solution-focused brief therapy. Again, these are just suggestions that I have, and the reason I say that is because when we focus on the solution, it becomes a lot easier to deal with the problem, and the longer I spend on the problem, the bigger the problem gets. And the problem is like such people, when the problem gets so big, the only solution that they then turn to is medication. And for a vast majority of individuals, medication is not appropriate. They did a survey with psychiatrists themselves. They said, if you were in the situation of your parents, would you give them the medication that you are prescribing for them? It was half, right? So half of the time, meaning that they're 2 times more likely to prescribe to someone else than they would themselves, which is a very telling number, and it's a very scary number. So these things are important for us to keep in mind when we discuss these issues, that we should never self-diagnose, we should never self-medicate, right? We should never decide for ourselves what it is that needs to be done, what not needs to be done. And we also need to understand that there are different ways and methods for us to take care of this. There are spiritual ways, there are spiritual methods, right? There are practical ways and logistic and methods for these therapies. We ask Allah subhanahu wa ta'ala to give us tawfiq and to protect us. Ameen.